I have reached out to, so a lot of the
I was just kind of thinking of different ways that I personally could be more involved with the COVID vaccine efforts, and noticing how much misinformation was out there and what can we do to help people become aware of what the COVID vaccine is and how it can actually help them.
There is hesitancy, especially with my community, with Somalis. The younger groups feel, oh, we're very healthy. I exercise, so COVID will not happen to me. And if it does, I won't die, so why do I need to get a vaccine? The elderly people are saying that, oh, if it's my time to die, and if Allah wants me to die, I will.
Given the trauma that some African communities have gone through when they were colonized by the Western world, they still have that problem. We still have that problem of trusting the Western world completely with our lives, our health, and all of that.
There was an unfortunate measles outbreak a few years ago. People were not wanting to vaccinate their children because of this belief that their children could get autism. And so this fear about autism, I think, kind of played into that measles outbreak. And then now what we have is, there's this mistrust around vaccines.
There's been a lot of media coverage about communities of color and trust around the COVID-19 vaccine, information that's being spread about the vaccine that's often false. This isn't a situation that's unique to communities of color, and it actually extends to everybody. My earlier work, kind of looking back through some of the research that's been published around vaccine attitudes in general, there are some interesting findings that found that among refugees and immigrants, for example, the longer they were in the US, certain communities would acculturate to the US, and with that came some of the US beliefs around vaccine and vaccine hesitancy. And so there is that concept too that we have to recognize as a society, is that trust and that communication is present in all of our communities, not just, white or communities of color, but it's really something that needs to be addressed everywhere.
In Latin America, we are educated to be vaccinated since the time we are born. So it is kind of natural for us. And we understand, because it's been our history, that the vaccines have been helping our communities to be more stable health-wise. But we are in the middle of some sort of unfortunate series of events that are come together and confuse people.
Yes, it is different because it's a pandemic. It's was created in a year, and then all these people, adding a lot of myths and scare into our communities, and I think those are the major reasons why that they decide not to take the vaccine or kind of scared to even take it.
There is a lot of word of mouth that happens in the community. There's a lot of stories that folks have heard, or there's a lot of perhaps wrong associations.
We serve migrant families, migrant agricultural workers that come to work on the fields, to work in food processing plants. I feel the families feel comfortable with me because I can speak Spanish and I can relate to their situations, being that my parents are Mexican American, and that I'm aware of the situation, that there is undocumented people around. So I think they trust me that I'm not out there to go and see who is not documented, who is. We all make them feel safe.
Pedro and Jocelyn came from Honduras, and they have their child here in Tri-Valley. They came to work for the canning company.
They work long hours, 12 hours, 6 days a week.
Mom works during the day, so she leaves at 6, comes back at 6, and Dad works at 6 in the afternoon to 6 in the morning. So they kind of alternate their shifts to be able to take care of the kids. They do have a lot of struggles, medical, transportation.
Ok, eso pasó los dos orejas. Escucha muy bien. Otra cosa que queríamos hablar ahora es sobre la vacuna de COVID. ¿Qué tanto saben de la vacuna o qué piensan de la vacuna o qué son sus pensamientos sobre la vacuna?
Me imagino yo que es como una protección contra el COVID. Como todas las vacunas que le ponen a los niños cuando están pequeñas, me imagino que es así.
Okay. ¿Y piensan en en ponerse la vacuna de COVID?
¿Están interesados en registrarse o quieren pensarla?
En el trabajo.
¿O la quieren pensar o ya se quieren
Es que
registrar?
en el trabajo nos dijeron que los iban a poner la vacuna ahí, pero no.
¿O en el trabajo?
Yo espero, no sé.
Esta es información sobre qué es la vacuna, cómo funciona en el cuerpo y qué esperar después que reciba la vacuna.
O sea, ya está al 100% que sí está cayendo bien.
Sí,
Porque ya ve que mucha gente estaba muriendo por eso.
No mucha gente. La vacuna no es un virus vivo. Te hace hacer defensas en tu cuerpo, igual que las otras vacunas.
Personas que las pusieron sí les dieron efectos por eso.
Vas a tener dolor en el área de inyección. Y por eso te pregunto qué dudas tienes, o sea, por qué piensas que se muere la gente.
Estás así como por los comentarios.
Por los comentarios.
Ajá, y que a uno le da temor, pues, pero si es necesario ponérsela, pues sí.
So migrants are people who travel more than 100 miles and look for work, but do not make this place a permanent home.
They are very vulnerable because they don't have insurance or because they don't have the language or they don't have access to resources. Very difficult just to find them where they are. So to deliver not only the vaccination but even the information about vaccines is really tough.
Workers in agriculture and some of the food processing plants, they're at higher risk of COVID-19 based off of often closer living quarters, shared transportation, working in close proximity environments.
The families in this community and the families that we see, they were afraid to say that they felt sick or anything because they were going to be out without pay. So then you would see a lot of COVID spreading within, and people were getting COVID and still working.
So they are a very essential group of people to be able to offer vaccine to.
Ya tenemos muchos años con las vacunas y el polio era una pandemia y ya no existe el polio porque nos vacunamos del polio. Pero aquí está para que lo lean, te explica todo. Eso es del Departamento de Salud.
Adiós. Bye bye.